Kidney stones are a common reason why people present to the emergency room. It can be exceedingly painful, and that the pain doesn't really relate to the size of the stone. It relates to the degree of blockage that that stone is causing. The stone didn't get there when the pain began. The stone had been there for a while, and then got stuck in the tube that connects the kidney to the bladder, which is called the ureter. And again, it's very painful because the kidney continues to make urine. The urine doesn't flow through. The collecting system expands, and again, that's a very painful situation. In terms of treatment, depending on the size of the stones, smaller stones have a higher chance of passing, and it's perfectly acceptable to give a stone a few weeks to pass, assuming that the patient's pain is not overwhelming. We usually treat this with pain medication, and if the stone successfully passes, then you're out of the woods for that one. Many patients have multiple stones. Some stones are larger. The larger ones that cannot actually get trapped in the tube tend to cause less symptoms because they don't tend to block the kidney completely, but stones can become very large and overtake large parts of the collecting system, which is a system that collects the urine and brings it down to the bladder via the ureter that I mentioned a few moments ago. However, large stones can destroy kidney tissue, and the larger ones that won't fit through the tube can be addressed with a procedure called percutaneous nephrolithotomy, which is a collaboration between interventional radiologists and urologists to introduce a nephroscope with the aid of the radiologist into this collecting system, and a special device helps us break up the stone and remove the fragments at that time. Usually a small tube is left overnight just to allow the kidney to drain, because blockage is the enemy of the kidney.